EMT practice test questions and answers with explanation. 35 fundamental questions. Question 1. Which of the following is an early sign of hypoxia? Cyanosis, restlessness, bradycardia, hypotension. Restlessness and anxiety are early signs of hypoxia. Cyanosis is a late sign. Question 2. You are treating a patient with a suspected myocardial infarction. What is the most important intervention? High-flow oxygen, administering aspirin, nitroglycerin, rapid transport. Aspirin prevents further clotting and is a critical early intervention in me. Question 3. A patient presents with cool, clammy skin and a rapid, weak pulse. These are signs of hypertension, hypoperfusion, shock, hypoglycemia, heat stroke. These are classic compensatory signs of shock. Question 4. What does the P in the AVPU scale stand for? Patient, pulse, pain, priority. AVPU stands for alert, verbal, pain, unresponsive. Question 5. Which organ is located in the right upper quadrant, RUQ? Spleen, appendix, liver, bladder. The liver is the primary organ in the RUQ. Question 6. What is the therapeutic effect of epinephrine in anaphylaxis? Vasodilation and bronchoconstriction. Vasoconstriction and bronchodilation. Pain relief. Slows the heart rate. Epinephrine constricts blood vessels to raise BP and dilates bronchioles to improve breathing. Question 7. A 22-year-old female is found unconscious in a park. You note pinpoint pupils and shallow breathing. You suspect alcohol poisoning, opioid overdose, cocaine overdose, hypoglycemia. Pinpoint pupils, meiosis, and respiratory depression are classic signs of opioid toxicity. Question 8. The normal respiratory rate for an adult is 8 to 12 breaths/min 12 to 20 breaths/min 20 to 30 breaths/min 10 to 25 breaths/min. 12 to 20 is the standard normal range for an adult. Question 9. A patient with a history of diabetes is found confused and diaphoretic. You should first check blood glucose level, administer oral glucose, perform a stroke assessment, administer high-flow oxygen. If the patient is conscious enough to swallow, checking BGL confirms hypoglycemia before treatment, though in many protocols, treatment is priority if BGL is not immediate. Question 10. Which of the following is a symptom of a stroke? Facial droop, arm drift, abnormal speech, all of the above. The Cincinnati Pre-Hospital Stroke Scale looks for facial droop, arm drift, and abnormal speech. Question 11. A patient has a large laceration to the forearm with spurting, bright red blood. This is venous bleeding, arterial bleeding, capillary bleeding, internal bleeding. Arterial blood is bright red, oxygenated, and spurts with the pulse. Question 12. In an MCI, a patient with a respiratory rate of 34 should be tagged green, yellow, red, black. In start triage, a respiratory rate 30 is an immediate, red, priority. Question 13. What is the golden hour in trauma? The first hour after injury where survival chances are highest. The time it takes to get to the hospital. The time spent on scene. The duration of the surgery. The golden hour refers to the critical time from injury to definitive surgical care. Question 14. A patient is complaining of tearing chest pain that radiates to the back. You should suspect myocardial infarction, aortic dissection, pulmonary embolism, angina. Tearing pain radiating to the back is a classic sign of an aortic dissection. Question 15. Which of the following laws protects bystanders who provide emergency care in good faith? HIPAA, the Ryan White Act, Good Samaritan laws, duty to act. Good Samaritan laws protect people who provide care without expectation of compensation. Question 16. The pressure remaining in the arteries when the left ventricle relaxes is systolic pressure, diastolic pressure, mean arterial pressure, pulse pressure. Diastolic pressure is the resting pressure in the arteries. Question 17. When assessing a patient's pupils, what does PERL mean? Pupils equal and round, regular light. Pupils equal and round, reactive to light. Pressure equal and reactive, restrict light. Pupils even and robust, react to light. PERL, pupils equal and round, reactive to light. Question 18. Which of the following is the best way to prevent the spread of germs? Wearing a mask, using gloves, hand washing, using a gown. Hand washing is the single most effective way to prevent infection. Question 19. What is the priority for a patient with an open chest wound, sucking chest wound? Apply a dry sterile dressing. Apply an occlusive dressing taped on 3 sides. Apply a tourniquet. Perform chest compressions. A 3-sided occlusive dressing allows air to escape but not enter the chest cavity, preventing a tension pneumothorax. Question 20. A patient has Battle's sign bruising behind the ears. This indicates nasal fracture, basilar skull fracture, concussion, epidural hematoma. Battle's sign and raccoon eyes are late signs of a basilar skull fracture.